Anatomy and physiology of dental prosthesis supporting structure. Dentists or prosthodontists have to know the anatomy and physiology of the bony structure that support the dental prosthesis, whether that dental prosthesis is a removable partial denture, implant supported partial denture or complete denture, or the dental prosthesis is a complete denture. The osteology or the anatomy and physiology of the bony foundation or bony structure of the edentulous area. It's important to know the support or help in support of the denture and maintain the retention and stability of the denture, and the physiology and anatomy of the mandibular and maxillary foundation area or bony area that support the denture have a direct relation to the impression making procedure, the position of the teeth when it is arranged in the trying procedure, in addition to the contouring of the denture base material of the denture. The maxillary and mandibular edentulous area can be divided into stress bearing area, stress relief area, and border limiting area. For the stress bearing area or the supporting area of the maxillary and mandibular edentulous area, the area of the edentulous bone that can support or suitable to withstand the masticatory force, while the stress relieving area is the area of the maxillary and mandibular edentulous area that cannot withstand or not suitable to withstand the masticatory force, because the anatomy and the type of mucosa and connective tissue that covering these edentulous area may be sensitive or affected or traumatized by the masticatory force. The other area of the edentulous bone is the border limiting area, which are the border or the area of the edentulous bone that limiting the extension of the denture base material. The factors that influence the form and the size of the supporting bone can be categorized to three factors. The factor that related uh, affect the size and form of the edentulous area before the extraction of the teeth, which include the type of extraction of the teeth, the time from the extraction of the teeth. When the time from extraction of the teeth is longer, that means more resorption of the alveolar bone, the amount of the alveoloplasty that occur during the extraction of the teeth. When the extraction of the teeth, the amount of alveoloplasty or removing of the bone during the extraction of the teeth is more bone removed, that means more resorption of alveolar bone. In addition, the severity of the periodontal disease that affect the teeth before extraction. When there is a severe periodontal disease, mean there is more resorption of the alveolar bone. In addition to the size and the form of the arch form, when the size of the arch form originally before the extraction of the teeth is large, that means the supporting bone become more bigger or larger. The other factor that influence on the size of the supporting bone is the wearing of the dental prosthesis, whether there is a previous dental prosthesis wearing by the patient or the force that applied by the new prosthesis that may affect on the supporting structure and cause more bone resorption. In addition to, there is unknown genetic predisposing factors that cause more bone resorption. The supporting structure of the maxilla include alveolar process. The alveolar process of the maxilla is regarded as the vertical extension of the maxillary bone downward and it formed by two plate, buccal plate and the palatal plate. The two plate are uh, united or form in the center of the alveolar ridge to form the alveolar process. After extraction of the teeth, the alveolar process is called the residual ridge, alveolar residual ridge. The alveolar residual ridge can support the denture during the function by transferring the occlusal force or the masticator force to the slopes of the residual alveolar ridge. So it's regarded as a secondary stability area or secondary stress bearing area of the maxillary denture. The incisive foramen look regard as the bony foramen through which the uh, nasal nerve bundle pass through it to the oral cavity and regard as a sensitive area and cause sensation to the patient, so it should be relieved and regard as a relief or stress relief area for the complete denture. The incisive foramen is near to the crest of the alveolar ridge or crest of the residual ridge due to the resorption of the alveolar ridge. The failure to relieve this area result in irritation and burning sensation of the anterior part of the palate of the patient. The incisive papilla regard as a stable, which is here, regard the stable landmark to the incisive foramen, and it regard as a biometric guidance for the position of the canine during the arrangement of the teeth of the complete denture or the partial denture, removable partial denture, by drawing a line posterior to incisive papilla that is perpendicular to the sagittal plane, and this line is indicating the position of the maxillary canine. In addition, the incisive papilla regard as a biometric guidance for the position of the anterior incisors, especially the central incisors, which are located 8 to 10 millimeter anterior to the incisive papilla. The malar process or the zygomatico-alveolar crest, which is located opposite to the position of the first molar region, and it's regarded as a stress relief area of the denture because can be cause soreness at this area when the denture is wearing by the patient, and it's aid when it's relieved aid in the retention of the complete denture, especially when there is a severe resorption at the posterior area. The maxillary tuberosity represents the dense fibrous connective tissue that extend from the area of the second molar to the cleft of the hamular notch, and this area regarded as good supporting area for the complete denture because have a condensed fibrous connective tissue with minimal compressibility. The hamular notch represents the limiting area, border limiting area for the complete denture, and represent the cleft that located between the tuberosity and the hamulus of the palatine bone. The hamular notch have a good connective tissue, loose connective tissue that could be represent a good posterior seal for the complete denture and should be not extend the denture uh, beyond this area or beyond the hamular notch because it could restrict the pterygomandibular raphe movement because the pterygomandibular raphe is inserted to the hamulus of the palatine bone. In addition, when the patient opens his mouth widely and the complete denture is extended beyond the hamular notch may cause dislodgement of the complete denture during function. The cuspid eminence, it represents the bony elevation that of the residual ridge that form after the extraction of the maxillary canine, and it's located over the canine root, and it's serve as a guidance for the position of the artificial canine. The palatine process of the maxillary canine. It represents the horizontal plates of the bony process of the maxilla that extend horizontally and united at the midline to form the mid-palatal suture or the mid-palatal raphe. The palate or the hard palate represent the primary stress-bearing area of the maxillary denture, and the mid-palatal raphe or the mid-palatal suture covered with resilience connective tissue that may be sensitive or for the denture during the wearing of the denture, so it should be relieved, and it is regarded as a stress relief area of the complete denture. Sometimes the mid-palatal suture have an bony overgrowth, and this bony overgrowth is called torus palatinus. The palatine bone. The horizontal plate of the palatine bone articulate anteriorly with the horizontal palatal process of the maxillary bone to form the posterior part of the hard palate. The palatine bone or the horizontal plate of the palatine bone unite at the midline posteriorly to form the posterior nasal spine. The posterior nasal spine and the posterior border of the palatine bone represent the extension of the soft palate. The soft palate comprised from the movable and non-movable tissue. The line demarcating or the line marking between the movable and non-movable tissue of the soft palate called the vibrating line. The posterior palatal seal area represents an important limiting posterior area for the complete denture and aid in the retention of the complete denture posteriorly. And this area extends posteriorly from the vibrating line, which represents the connection between movable and non-movable tissue of the soft palate, and anteriorly with the with the posterior border of the hard palate. Thank you.